Hello everyone. This lecture is going to be the series of clinical case scenarios for more than 1000 clinical cases for the medical student and for those who want to study for the International Physiotherapy License exam. So let's begin the part 1 of our series. So the first case scenario we have, physical therapist is testing the trunk of the 36-year-old male patient who has the history of stroke. The patient is in prone position, moves into the direction of the trunk extension with her hands behind the ears. The trunk extension includes the following muscles. Option A, interspinalis. Option B, rectus spinae. Option C, rectus abdominis. And the option D, semispinalis thoracic. And the correct answer is rectus abdominis muscle, which is the flexor of the trunk, not the extensor of the trunk. So here we have the explanation. Rectus abdominis is a trunk flexor, and the trunk extensor includes interspinalis, rectus spinae, semispinalis thoracic, and multifidus. These all muscles are included in the trunk extensor. A patient who is able to perform the trunk extension with the hands behind the ears is a normal result. A poor result is characterized by moving into the direction of the trunk extension as the arm follows. So moving toward the next scenario, the ankle and the foot are the complex structures that work together during the gait to provide the balance as the body moves over the uneven ground surface. The ankle joint is responsible for the following. Option 1, lateral adjustment. Option 2, stability. Option 3, rotational motion. And the option 4, medial adjustment. So the correct answer is stability. So here we have the explanation of the option B. The ankle joint is responsible for the forward motion and the stability. The foot joint are responsible for the medial and lateral adjustment. At the heel strike, the initial contact occurs at the posterior lateral aspect of the heel. And at the mid stance, the weight of the body is behind the metatarsal head. And at the face of toe off, the weight is mainly over the first and second metatarsal head. Moving toward the next scenario, a 55-year-old female patient who had a recent total knee replacement is ordered an assistive device that aims to help her with the balance and walking. So which of the following ambulatory assistive device can give the patient more stability? The option 1, knee support crutches. The option 2, forearm crutches. Option 3, cord cane. And the option 4, standard walker. And the correct answer is option D, standard walker. So let's see the explanation. The standard walker has 4 non-skid rubber tipped legs to provide the stability and considered for the patient who had total knee replacement or having the significant impairment with walking and balance. This walker is usually recommended to the patient who has good upper limb strength. Let's move toward the scenario number 4. A male patient is referred to the clinic for cardiac rehabilitation program. The history of the patient reveals a diagnosis of myocardial infarction involving the left coronary artery. This artery was divided into 2 major arteries, the left anterior descending artery and the circumflex artery. The left descending artery supplies which of the following? Option 1, lateral surface of the left ventricle. Option 2, sinoatrial nodes. Option 3, anterior ventricular wall. Option D, right atrium. And the correct answer is option C, anterior ventricular wall. And the explanation is the left anterior descending artery supplies the anterior ventricular wall. And the option A, the lateral surface of the left ventricle, is supplied by the circumflex artery. And the sinoatrial node, which is option number 2 or option B, which is supplied by the right coronary artery. And the option number D is also supplied by the right coronary artery. So now see the last scenario of this part. The cerebral cortex, the outer gray matter of the brain, is mainly responsible for the conscious activity of the cerebrum. The cerebral cortex consists of the four lobes. The Wernicke's area is for sensory, and the speech area is located in which lobe? Option 1, frontal lobe. Option 2, occipital lobe. Option 3, parietal lobe. Option D, temporal lobe. And the correct answer is option D, temporal lobe. And the explanation is the Wernicke's areas for the sensory and speech is located in the temporal lobe. The Broca's areas for the speech is located in the frontal lobe. The visual area is found in the occipital lobe. Interpretation of the touch, pain, pressure, and the temperature occur in the parietal lobe. So that's all for today. We will cover the next scenarios in our upcoming lectures. Thanks for watching.